I think patients need to own their health care. I think they need to take it back. I think they need to understand the costs of health care. Just because we have an economic downturn in 08, 09 doesn't mean that I should be the one that talks to them about health care costs, but that's where I started it, was after the costs they were choosing, whether or not they were going to put health care in their top 3 or 4 priorities of their cost. When the economy turned around, people became very aware of their retirement funds and their bank accounts and what car they drove. But they also saw a huge uptick in the cost of their care, whether that was copays or deductibles. And in that process, it made the average patient or family make decisions that put their health care down the line. They had to decide on gas in their car, food on the table, uniforms for soccer, and then healthcare kind of became a little bit more of a lower tier priority. And what that's kind of created, I think, is more sick patients, more patients deferring care, more patients waiting on care. And as a result of that, we're seeing sicker patients by the time they come in and see us, or my colleagues who might be emergency room physicians see sicker patients, specialists see sicker patients. And that delay delays the care, but also increases the cost and maybe increases the morbidity and mortality. So I think our system, from a consumer standpoint, patients, I think, could benefit by knowing the cost of care, knowing what outpatient costs are. Say, what is a surgery at an outpatient surgical center cost versus in a hospital? Same for imaging. What is the cost of an X-ray or MRI at the hospital versus the cost of a same image in a different setting? And of course, prescriptions. We've got access to great generic medications. Doesn't mean that the newest and most expensive medicine is best. Sometimes just asking, is there a generic or is there a different medication that might be a little cheaper for me to try first? But ultimately, I think physicians still, providers have a heart for medicine to do the right thing. And I think the barrier that I see the most now is just that relationship. The relationship that the doctor and the patient are yearning for, better communication, maybe that eye contact that's not blocked by a computer, maybe it's not blocked by the patient on their iPhone. I joke with patients that they go to the internet for an opinion and they come to me for the second opinion. And I know that the internet can be a very powerful, positive thing, but I think that also just getting back to communication and eye contact and just the human touch, the human heart is missing sometimes too.